Good health is not determined by one single habit. It is shaped over time by repeated behaviors. Just as positive daily actions can strengthen your body and mind, certain harmful patterns, especially when repeated consistently, gradually damage nearly every system in the body. Many of these damaging factors are common in modern life and often normalized. Understanding how they affect your biology is the first step toward protecting your long-term health. Here are 7 scientifically established factors that significantly damage health when they become chronic. Chronic sleep deprivation. Sleep is not optional recovery time. It is a biological necessity. During sleep, your brain clears metabolic waste through the glymphatic system, your immune cells regenerate, hormones rebalance, and tissues repair. Consistently sleeping less than the recommended 7 to 9 hours for most adults increases the risk of obesity, type 2 diabetes, cardiovascular disease, depression, and weakened immunity. Sleep deprivation disrupts insulin sensitivity, meaning your body becomes less efficient at regulating blood sugar. It also increases cortisol levels, which promotes fat storage and inflammation. Inadequate sleep impairs cognitive function, slows reaction time, and reduces emotional regulation. Over months and years, poor sleep significantly raises the risk of chronic disease. Highly processed, ultra-refined foods. Ultra-processed foods are typically high in refined carbohydrates, added sugars, unhealthy fats, sodium, and artificial additives, while being low in fiber and essential nutrients. Examples include packaged snack foods, sugary cereals, fast food, processed meats, and many frozen ready-made meals. These foods often cause rapid blood sugar spikes followed by crashes, contributing to insulin resistance over time. High intake is associated with obesity, cardiovascular disease, metabolic syndrome, and certain cancers. Additionally, diets high in ultra-processed foods reduce gut microbiome diversity. Since the gut microbiome plays a major role in immune function and inflammation control, this imbalance can weaken systemic health. Physical inactivity. The human body is designed for movement. Prolonged sitting and low physical activity levels impair circulation, reduce muscle mass, weaken bones, and slow metabolism. Sedentary behavior is independently associated with increased risk of heart disease, type 2 diabetes, certain cancers, and premature mortality. Muscle tissue plays a key role in glucose regulation. When muscle mass declines due to inactivity, insulin sensitivity decreases. Inactivity also weakens cardiovascular fitness, reducing the heart's efficiency. Even if someone exercises occasionally, sitting for extended periods without movement breaks can still negatively impact health. Regular moderate activity improves mitochondrial function, supports joint mobility, enhances mood, and strengthens immune response. Avoiding prolonged inactivity is essential for long-term resilience. Chronic psychological stress. Acute stress is normal and adaptive. Chronic stress, however, keeps cortisol levels elevated for extended periods. Persistently high cortisol increases blood pressure, suppresses immune function, disrupts sleep, and promotes abdominal fat accumulation. Chronic stress also contributes to systemic inflammation. Inflammation, when prolonged, plays a central role in heart disease, neurodegenerative disorders, and metabolic conditions. Additionally, stress influences behavior, often increasing cravings for sugar, reducing motivation for exercise, and impairing sleep patterns. Managing stress does not mean eliminating challenges. It means developing coping mechanisms, such as regular physical activity, structured routines, social support, relaxation techniques, and adequate sleep. Smoking and tobacco use. Smoking remains one of the most well-established causes of preventable disease worldwide. Tobacco smoke contains thousands of chemicals, many of which are toxic and carcinogenic. Smoking damages blood vessels, increases blood clot risk, reduces oxygen delivery to tissues, and weakens immune defenses. It is strongly linked to lung cancer, chronic obstructive pulmonary disease, COPD, heart disease, stroke, and multiple other cancers. Even low levels of smoking significantly increase health risks. There is no safe level of tobacco exposure. Quitting smoking, even later in life, measurably reduces disease risk and improves cardiovascular and respiratory function over time. Excessive alcohol consumption. While moderate alcohol intake may fit into some lifestyles, excessive consumption clearly damages health. Alcohol disrupts liver function, increases triglyceride levels, impairs immune response, and interferes with sleep architecture. Chronic heavy drinking increases the risk of liver disease, hypertension, certain cancers, including breast and liver cancer, and mental health disorders. Alcohol also contributes to accidents and injuries due to impaired judgment and coordination. Even moderate drinking can reduce sleep quality by fragmenting deep sleep phases. Since sleep is essential for recovery and immune regulation, regular excessive alcohol intake indirectly damages multiple body systems. Social isolation and lack of meaningful connection. Human beings are biologically wired for social interaction. Chronic loneliness and social isolation are associated with increased inflammation, higher cortisol levels, and greater risk of cardiovascular disease and depression. Studies show that strong social connections are linked to longer lifespan and better immune function. Emotional support buffers stress responses and promotes psychological resilience. Isolation, on the other hand, can worsen health behaviors such as poor diet, inactivity, and substance misuse. Maintaining even a small circle of supportive relationships significantly improves long-term health outcomes. Important nuance: patterns matter more than occasional mistakes. It is crucial to understand that health damage typically results from repeated patterns, not isolated events. One night of poor sleep, one fast food meal, or one stressful week does not permanently harm the body. The human body is highly adaptable and capable of recovery. The risk arises when harmful behaviors become daily habits. Chronic sleep loss, daily consumption of ultra-processed foods, persistent inactivity, ongoing high stress, smoking, heavy drinking, and long-term isolation compound over time. These factors often interact with each other, amplifying damage. For example, stress can reduce sleep. Poor sleep increases cravings for unhealthy food, and inactivity further weakens metabolic control. The body's capacity to recover. One encouraging truth is that the body can repair much of this damage when habits improve. Sleep restoration improves insulin sensitivity. Exercise enhances cardiovascular health within weeks. Smoking cessation reduces heart disease risk significantly within a few years. Dietary improvements can reduce blood pressure and inflammation in months. Health is dynamic. It constantly responds to your behavior. Final perspective. Avoiding these 7 damaging patterns: chronic sleep deprivation, ultra-processed foods, inactivity, persistent stress, smoking, excessive alcohol use, and social isolation, does not require perfection. It requires awareness and consistency. The body thrives when it receives adequate sleep, nutrient-dense food, regular movement, emotional balance, clean air, moderate alcohol or none at all, and supportive relationships. When these foundations are protected, the risk of chronic disease decreases significantly, energy improves, and resilience strengthens. Health is not built in extremes. It is protected by avoiding the silent, repeated habits that slowly undermine it.